A patient came into the clinic complaining from dental pain, in addition to sharp and short pain while drinking cold water. After examination, the dentist has discovered carious lesions invading the dentine. Dentine is a rigid but elastic mineralized tissue which consists of a large number of small parallel tubules in a mineralized collagen matrix and forms the bulk of the tooth. It's covered by enamel in the crown and cementum in the root. The odontoblasts are responsible for dentine formation in a process called dentinogenesis, which is continuous throughout the life and involves 4 phases: the pre-odontoblast, the secretory, the transitional and the aged phase, resulting in pre-dentine that mineralizes into dentine within 24 hours. Mantle dentine represents the outermost layer of dentine, which is the first layer to form in the crown. It's characterized by von Krafft's fibers. Root dentinogenesis is similar to coronal dentinogenesis with few differences, as root sheath epithelium fills the space with an amorphous ground substance and a fine fibrillar non-collagenous matrix called the hyaline layer. Circumpulpal dentine has 2 forms, the linear form which represents slow mineralization, and the globular form which represents fast mineralization. Dentinal tubules contain the processes of the odontoblasts that are responsible for their formation. They also may contain afferent nerve terminals. Dentinal tubules are less in number and are narrower as we go closer to enamel, while the opposite is seen closer to the pulp. Those tubules are the main pathway for the carious invasions and dentinal hypersensitivity too, which is characterized by sharp and short pain in response to thermal, osmotic, or other types of stimuli due to a higher number of the exposed dentinal tubules than normal. Secondary dentine is the dentine formed after complete tooth formation and is less tubular than the primary dentine. Tertiary dentine is formed in response to trauma or pathological stimulus such as caries and has 2 types. The first type is the reactionary dentine, which involves a response to an injury to the odontoblasts and resulted in their survival, and it may involve an injury to health cells as well. It is similar in structure to secondary dentine or can have an irregular pattern. The second type is the reparative dentine, which involves a response to necrotic pulp injury, which means the odontoblasts have died. Here the tertiary dentine is formed by odontoblast-like cells that differentiate from pulpal progenitor cells, forming the reparative dentine, which is mostly amorphous due to the absence of the odontoblastic processes.